Have you ever noticed your legs feeling weaker, making everyday activities like climbing stairs or even just standing up more challenging? As we age, maintaining strong legs is crucial for our independence, balance, and overall quality of life. However, there are certain common habits and overlooked factors that may be quietly undermining your leg strength without you even realizing it. In this video, we will explore 7 critical mistakes that doctors warn are actively destroying your leg strength. Understanding these mistakes and knowing how to correct them can be the key to maintaining strong, mobile legs well into the future. So, stay with us until the very end as we dive into the 7 worst habits that could be weakening your legs and, more importantly, what you can do to protect them and stay active for years to come. If you're finding this information helpful so far, don't forget to like this video, leave a comment, and subscribe to the channel for more tips on staying healthy as you age. Now, let's get started. Mistake 1. Prolonged sedentary behavior and lack of physical activity. The problem: spending extended periods sitting, reclining, or lying down without engaging in physical activity is one of the leading causes of leg muscle weakness, particularly in older adults. When we remain sedentary, our muscles are underused, and over time, this can lead to muscle atrophy, especially in the legs. For seniors, this is even more concerning as the process of muscle loss, known as sarcopenia, speeds up after the age of 60. Sarcopenia not only weakens muscles but also increases the risk of falls, fractures, and a general decline in physical mobility. Why it's destructive: muscles need consistent movement and mechanical stimulation to stay strong and functional. When we don't move enough, the body doesn't get the necessary signals to maintain muscle tissue. This causes a decline in muscle protein synthesis, and over time, muscle fibers, especially the fast-twitch fibers that are responsible for strength and power, start to shrink. This leads to reduced muscle mass, weakened strength, and impaired overall physical performance. Additionally, inactivity can contribute to other health issues like cardiovascular disease, insulin resistance, and obesity, all of which further exacerbate muscle weakness and physical decline. What doctors advise? To combat the effects of prolonged inactivity, doctors recommend incorporating regular physical activity that specifically targets the leg muscles. Weight-bearing exercises like brisk walking, hiking, or stair climbing are great for stimulating muscle growth and improving endurance. Additionally, resistance training such as squats, lunges, or leg presses is crucial for building and maintaining leg strength. For seniors, even low-impact activities like chair exercises or water aerobics can be highly beneficial. Doctors also stress the importance of breaking up long periods of sitting with short bouts of movement throughout the day. Standing, stretching, or taking a 5 to 10-minute walk every hour can help counteract the negative effects of sitting. If you're unsure where to start, a physical therapist or certified trainer can create a personalized exercise plan to ensure safety and effectiveness. By staying active and regularly engaging your leg muscles, you can help prevent atrophy and preserve strength, mobility, and independence for years to come. Mistake 2. Poor nutrition, insufficient protein intake. The problem: muscles are primarily made up of protein, which is essential for muscle repair, maintenance, and growth. As we age, our bodies become less efficient at synthesizing muscle protein, a condition known as anabolic resistance. This makes it even more critical for seniors to consume adequate, high-quality protein to preserve muscle mass. Unfortunately, many older adults do not meet their protein requirements, which can contribute to muscle breakdown and further weakness. In addition to insufficient protein, deficiencies in essential nutrients like vitamin D, calcium, and omega-3 fatty acids can also impair muscle function and exacerbate weakness. Why it's destructive: without enough protein, the body lacks the essential amino acids needed to repair muscle fibers that experience micro tears during daily activities or exercise. This hampers the muscle maintenance process and accelerates age-related muscle loss, making it harder to regain strength even with physical activity. Furthermore, inadequate protein intake hinders the body's ability to recover from exercise, reducing the effectiveness of strength training programs. Beyond protein, deficiencies in key micronutrients like vitamin D, which supports muscle contraction, and magnesium, which aids in muscle relaxation, can compound muscle weakness and increase the risk of cramps, fatigue, and injury. Without a proper balance of these nutrients, muscle function suffers and the body becomes more vulnerable to further physical decline. What doctors advise? Doctors recommend a nutrient-dense, balanced diet that emphasizes high-quality protein sources. Lean options such as fish, for example salmon, tuna, poultry, eggs, legumes, for example beans, lentils, chickpeas, tofu, Greek yogurt, and low-fat dairy are excellent choices. For seniors, aiming for around 1.0 to 1.2 grams of protein per kilogram of body weight daily is often advised, though individual needs can vary based on activity levels and health status. It's also important to spread protein intake evenly across meals to maximize muscle protein synthesis throughout the day. Adequate calorie intake is just as important to prevent the body from breaking down muscle tissue for energy. If you struggle to meet your protein needs through food alone, consulting a registered dietitian or nutritionist can be highly beneficial. They can assess your dietary habits and suggest meal plans or supplements like protein powders or vitamin D to ensure you're meeting your nutritional goals. A balanced diet will not only protect your muscles but also improve your overall health and energy levels. Mistake 3. Ignoring pain and avoiding movement. The problem, as we age, many seniors experience joint pain, stiffness, or discomfort due to chronic conditions like osteoarthritis, rheumatoid arthritis, or tendinitis. While it's natural to want to avoid activities that cause pain, completely refraining from movement can make the problem worse over time. Inactivity weakens the muscles that support and stabilize the affected joints, reducing their ability to absorb shock and maintain proper alignment. This creates a vicious cycle where muscle weakness leads to more joint instability, which in turn causes even more pain and further limits mobility. Why it's destructive: avoiding movement due to pain accelerates muscle atrophy, particularly in the muscles surrounding the affected joints such as the quadriceps, hamstrings, and calves. Weak muscles provide less support to the joints, which increases stress on cartilage, ligaments, and tendons, intensifying pain and inflammation. Over time, this can lead to significant functional limitations, making it difficult to perform basic daily tasks like walking, climbing stairs, or standing up from a chair. In severe cases, this cycle can result in a loss of independence and an increased risk of falls and injuries. The longer the inactivity continues, the harder it becomes to break the cycle, leading to further muscle weakness and a decline in overall mobility. What doctors advise? Doctors strongly recommend addressing the root cause of pain and not simply avoiding movement. It's crucial to seek medical evaluation rather than ignoring discomfort. A healthcare provider may recommend diagnostic tests such as X-rays or MRIs to identify the underlying condition and create a targeted treatment plan. Pain management strategies could include medications like anti-inflammatories, analgesics, corticosteroid injections, or alternative therapies like acupuncture. However, physical therapy is often the cornerstone of treatment. Tailored exercises can strengthen the muscles around affected joints, improve flexibility, and enhance joint stability. Low-impact exercises like swimming, stationary cycling, or water aerobics can maintain muscle strength without overloading painful joints. In some cases, assisted devices like braces or orthotics may be recommended to support mobility. Working with a physical therapist ensures that exercises are performed safely and progressively, minimizing discomfort while maximizing the benefits of movement. By continuing to move, even with pain, and using appropriate treatments and support, you can prevent further muscle weakness and preserve your mobility for years to come. Mistake 4. Dehydration. The problem: water is essential for nearly every physiological process in the body, including muscle function. Since muscles are made up of approximately 75% water, dehydration can significantly impair muscle performance, leading to fatigue, cramping, and reduced strength. Seniors are particularly vulnerable to dehydration due to a weakened thirst mechanism that comes with age. Additionally, certain medications, such as diuretics, can increase fluid loss, further contributing to the risk of dehydration. Chronic mild dehydration may not always be immediately noticeable, but its cumulative effects on muscle health can slowly affect physical function. Why it's destructive: when the body is dehydrated, it struggles to deliver nutrients such as glucose and electrolytes to muscle cells. It also becomes less efficient at removing metabolic waste products like lactic acid that accumulate during physical activity. This disruption impairs muscle contraction, endurance, and recovery, making physical tasks feel more strenuous and increasing the risk of cramps, injuries, or fatigue. Over time, chronic dehydration contributes to muscle weakness and a general decline in physical performance, especially when combined with other risk factors like inactivity or poor nutrition. Inadequate hydration also impacts recovery after exercise, reducing the body's ability to repair muscle tissue and regain strength. This can result in prolonged soreness and slower progress in strength training or physical therapy, further hindering overall mobility. What doctors advise? Doctors recommend consistent hydration to support muscle health and overall well-being. A general guideline is to drink 8 to 10 cups, 64 to 80 ounces of water daily, but individual hydration needs vary depending on body size, activity level, climate, and any existing health conditions. It's important to drink throughout the day rather than waiting until you're thirsty, as thirst may not be an accurate indicator, especially in older adults. In addition to water, foods with high water content, such as fruits, for example watermelon, oranges, and vegetables, for example cucumber, celery, can also contribute to hydration. When engaging in physical activity or experiencing hot weather, it's crucial to increase fluid intake to replace the fluids lost through sweat. For seniors with medical conditions like kidney disease or heart failure, it's essential to discuss fluid needs with a doctor to avoid complications. Reminders, such as setting alarms or keeping a water bottle nearby, can help establish a routine of regular hydration, ensuring that muscles stay well hydrated and ready to perform. Maintaining proper hydration is a simple yet effective way to protect muscle health, reduce the risk of cramps and fatigue, and improve overall physical performance. By prioritizing hydration, you can help ensure your muscles function at their best. Mistake 5. Certain medical conditions and medications. The problem: several medical conditions and the medications used to treat them can directly or indirectly impair leg muscle strength and function. Conditions like diabetes can lead to peripheral neuropathy, causing nerve damage that disrupts the communication between the brain and leg muscles. Thyroid disorders, such as hypothyroidism, can slow down metabolism and reduce the energy production necessary for muscle function. Cardiovascular diseases, like peripheral artery disease, limit blood flow to the legs, leading to weakness and fatigue. Additionally, certain medications, such as statins used for cholesterol management, corticosteroids, and diuretics, may have side effects that include muscle weakness, cramps, or fatigue, further complicating muscle health. Why it's destructive: these medical conditions and medications interfere with crucial processes that support muscle function. For instance, peripheral neuropathy hampers the nervous system's ability to communicate with the muscles, reducing coordination and strength. Poor blood flow from cardiovascular issues deprives muscles of oxygen and nutrients, leading to fatigue and weakness. Medications, on the other hand, can disrupt muscle protein synthesis, electrolyte balance, or mitochondrial function, all essential for muscle maintenance. Over time, these factors can significantly impair leg strength, hinder mobility, and increase the risk of falls and injuries. What doctors advise to preserve leg strength and muscle function, managing underlying medical conditions is crucial. This includes regular medical checkups and adherence to prescribed treatments to control conditions like diabetes, hypertension, and thyroid disorders. For example, maintaining stable blood sugar levels through diet and medication can minimize nerve damage in diabetic patients, improving muscle strength. If muscle weakness or fatigue develops after starting a new medication, it's important to consult a doctor immediately. The healthcare provider may assess whether the medication is contributing to the symptoms and adjust the dosage, switch to an alternative medication, or implement strategies to mitigate the side effects. In some cases, physical therapy or nutritional interventions may be recommended to support muscle health. Open communication with healthcare providers is essential to address any changes in muscle function. By staying on top of medical conditions and adjusting treatments as needed, you can help maintain muscle strength, preserve mobility, and reduce the risk of falls and other injuries. Mistake 6: poor footwear and lack of attention to foot health. The problem: the shoes you wear play a crucial role in supporting the health of your feet, legs, and overall musculoskeletal system. Ill-fitting, unsupportive, or inappropriate shoes such as those that are too tight, too loose, lack adequate arch support, or have worn-out soles can significantly affect your natural gait and balance. High heels, for example, shift weight unnaturally onto the forefoot, while flat, unsupportive sandals fail to provide the necessary shock absorption or stability for your feet. In addition to poor footwear, untreated foot conditions like bunions, corns, calluses, plantar fasciitis, or neuromas can cause persistent pain and inflammation, forcing you to alter your walking pattern to avoid discomfort. These changes in how you walk or stand can lead to uneven muscle use in the legs, weakening specific muscle groups over time. Why it's destructive: your feet are the body's primary point of contact with the ground, and any dysfunction in their structure or support can have a domino effect throughout the lower body. When footwear doesn't provide proper support, or when foot pain forces you to adjust your movement, it can create imbalances in the muscles of your legs. For example, compensating for pain from plantar fasciitis might cause you to favor one leg or shift your weight to the outer edge of your feet. This uneven distribution of strain causes some muscles such as the calves, quadriceps, and hamstrings to be overworked, while others, like the tibialis anterior, may be underused. Over time, these imbalances lead to chronic muscle weakness, joint stress, and an increased risk of injuries, including shin splints, knee pain, or ankle sprains. Additionally, poor foot health can worsen existing conditions like arthritis or diabetic neuropathy, further limiting mobility and causing discomfort. This accumulation of issues can lead to a weakened lower body, poor stability, and a higher risk of falls, especially among older adults. What doctors advise to maintain strong legs and optimal mobility: it's essential to prioritize proper footwear that provides adequate support for your feet. Shoes should fit well, offer enough room for your toes to move, provide strong arch support, and have a stable sole to absorb impact. Worn-out shoes should be replaced regularly as their cushioning and support degrade over time. For individuals with specific foot issues such as flat feet, high arches, or bunions, seeing a podiatrist is highly recommended. A podiatrist can assess your feet, conduct gait analysis, and provide custom solutions like orthotics, physical therapy, or corrective exercises to improve foot health and leg strength. Incorporating foot-strengthening exercises into your routine, such as toe curls, arch lifts, and picking up small objects with your toes, can help improve muscle tone and flexibility. Mistake 7: ignoring early warning signs of weakness or balance issues. The problem, as we age, the gradual onset of leg weakness or balance issues is often so subtle that it's easily overlooked or attributed to the natural aging process. Many individuals dismiss early indicators such as slight difficulty rising from a low chair, needing to grip handrails while climbing stairs, or feeling unsteady when walking on uneven surfaces. Other signs, like frequent tripping, a sense of heaviness in the legs, or occasional stumbles, are often brushed off as temporary or insignificant. Unfortunately, ignoring these early warning signs can delay crucial interventions, allowing muscle weakness and balance impairments to progress unchecked. Why it's destructive: when early signs of weakness or imbalance are ignored, they can rapidly worsen, leading to a significant decline in function. Recognizing and addressing these issues early on is critical because timely intervention can prevent further deterioration and, in some cases, even reverse the progress of these problems. For example, targeted strength training, balance exercises, or physical therapy can rebuild muscle mass, enhance coordination, and restore confidence in movement. However, postponing treatment allows muscle atrophy and balance deficits to worsen, making it much harder to regain strength and stability. Untreated weakness and instability increase the likelihood of falls, which can result in serious injuries like fractures, head injuries, or a fear of falling that leads to reduced physical activity. This creates a vicious cycle of further muscle loss, diminished mobility, and social isolation, ultimately eroding independence and overall health. What doctors advise? Doctors encourage cultivating awareness of your physical abilities and remaining vigilant for any changes, no matter how minor they may seem. Pay attention to your ability to perform routine tasks such as standing up from a seated position, walking briskly, or navigating stairs without support. If you notice any difficulty, such as muscle fatigue, trembling, unsteadiness, or a tendency to lose balance during everyday activities, it's important to seek medical advice. Early intervention can make a big difference. A healthcare provider may refer you to specialists such as a neurologist, orthopedist, or physical therapist for a comprehensive evaluation. Diagnostic tests such as blood work, nerve conduction studies, or imaging can help identify underlying causes, while a physical assessment can pinpoint specific areas of weakness or imbalance. Based on the evaluation, your doctor may recommend a personalized exercise program that includes resistance training to build leg strength, balance exercises like single leg stands or Tai Chi to improve stability, and aerobic activities to enhance endurance. Physical therapy can also provide targeted interventions such as gait training or proprioception exercises to address specific deficits. Conclusion: in this video, we've explored the 7 critical mistakes that doctors warn can actively destroy your leg strength, and we've provided actionable advice to help you protect and preserve your mobility. From avoiding prolonged sedentary behavior to ensuring proper hydration, nutrition, and foot health, each of these factors plays a vital role in maintaining strong, healthy legs as we age. By staying vigilant and addressing issues like muscle weakness, poor nutrition, and balance problems early on, you can improve your leg strength, enhance your overall well-being, and reduce the risk of falls and injuries. Incorporating regular physical activity, paying attention to nutrition, managing medical conditions, and using proper footwear are all essential steps to ensure your legs stay strong and functional for years to come. Now, it's time to put what you've learned into action. Reflect on the advice shared in this video and think about one specific change you can make in your daily life to support your leg health. Whether it's incorporating a short walk into your routine, adjusting your diet to include more protein, or simply taking breaks from sitting, every small change can make a significant difference. If you found this video helpful, please leave a comment below with one action you're committed to taking, like this video, and share it with others who could benefit from these tips. Don't forget to subscribe to our channel for more videos focused on senior health, mobility, and overall well-being. Thank you for watching, and remember, keeping your legs strong is key to maintaining your independence and enjoying an active, fulfilling life. Stay active, stay healthy, and keep moving forward.